further divided by a transverse septum, that is the intertransverse intermuscular septum, or we can also term the transverse facial septum. It further divides the different muscles that are present in the posterior compartment into superficial and the deep group. Here you can see the superficial group and the deep group. The superficial group of muscles contains three important muscles that are responsible for the prominence of the calf muscles. These are the lateral and the medial head of the gastrocnemius, the most superficial muscle. Then we have the soleus and plantaris. The deep group contains four muscles. Total muscles that are present in the posterior compartment of the leg are 7 in number. The deep group, we have the different muscles. The deep group, the entire deep group is plus the superficial group is supplied by single artery and nerve, but that is present in the deep group, not in the superficial group, but they are responsible to supply the muscles in the superficial group also. The transverse intermuscular septum, later on they continues as the flexor retinaculum, reinforces with the flexor retinaculum, deep down it descends and then reinforces with the flexor retinaculum, that is attached to the medial malleolus and the calcaneum. This is a slide again for the revision of the different muscles that are present when you will go in your model study. There is revision of compartments of the posterior compartment of the leg as well. Then you are able to identify the muscles of the models as well. The gastrocnemius, you can easily identify the most superficial muscle that is present in the posterior compartment. Here, fibula, for fibula, I told you there is a sesamoid bone, and if it is present in the lateral head of the gastrocnemius muscle. This is the lateral head of the gastrocnemius muscle, and here we have the medial head of the gastrocnemius muscle. Lateral head, we have the medial head of the gastrocnemius muscle. This is the lateral head, and here we have the medial head of the gastrocnemius muscle. The two muscles are present over here. Now, when we cut and dissect the lateral and medial head of the gastrocnemius muscle, we are able to identify the long cylinder-like muscle having a long tendon. The tendon of the plantaris is much longer as compared to the muscle belly. This is the plantaris muscle, and it is mistaken by the nerve most of the time. This is in the surgical procedure. That's why I told you it is used in the reconstructive procedure. Here you can easily identify the soleus muscle. This is the soleus muscle. They both, the three heads, triceps suri, which we talked, which I told you, the medial head, the lateral head of the gastrocnemius, and the soleus, they together form a common tendon that is called the calcaneal tendon or the Achilles tendon. And these three heads together are called triceps suri, that is inserted on the posterior surface of the calcaneum. Now this is a slide which shows the origin of the soleus muscle, which I told you that it originates as an inverted U-shaped fashion manner, and that soleus muscle, this is the soleus muscle, origin from the posterior surface of the fibula, head of the fibula, and from the posterior surface of the tibia. So it resembles like inverted U. This is the soleus origin. Here is the soleus origin. This is important because the nerve, tibial nerve, that is responsible to supply the posterior compartment, and the posterior tibial artery, that is responsible to supply the posterior compartment of the leg muscles. All the muscles of the posterior compartment passes through this tendinous arch. It goes through, when they exit the popliteal fossa, here the popliteal fossa, the two heads of the gastrocnemius muscle helps to form the inferior boundary of the popliteal fossa. When they exit through the popliteal fossa, it passes through this tendinous arch. the tibial nerve and the popliteal artery. Now, this is in a beautiful slide showing the different how tendon, the separate tendon for the plantaris. Somebody asked me in the chat box in my previous lecture regarding the plantaris. That's why I put this slide regarding the plantaris and the calcaneum tendon. So here you can easily identify that there is a separate tendon for the plantaris and for the Achilles tendon, or we can term it calcaneal tendon. Look at this slide. This is the calcaneal. Here you can easily identify the soleus and the two heads of the gastrocnemius. They both converge and they together form the calcaneal tendon that is inserted in the posterior surface of the calcaneum. This is long cylinder-like tendon for the plantaris, and it also gets inserted to the calcaneum. We can say just medial to the calcaneal tendon, there is insertion for the plantaris. This is the medial part and this is the lateral part of the calcaneum. Or plantaris is tendon is anterior to the calcaneal tendon, we can say. So this is a separate tendon for the plantaris, and this is Achilles tendon for two important muscles, that is the gastrocnemius and the soleus muscle. So these are the all superficial subcompartment muscles, they get inserted over the calcaneum bone. The proximal, the osteology of the foot you will cover in your next session on Tuesday. For the proximal row contains two important bones, the calcaneum and the callus. And on the distal row, there is they are cuboid, cuneiform, three cuneiform, cuboid, and the navicular bone. Just have a look on this slide, the muscles of the superficial group, and this is the tendinous arch-like structure which I told you. It forms like a U-shaped structure, the soleus muscle. Here you can easily identify the soleus, middle 1/3 the soleus, the superficially the plantaris, which one student asked me, the plantaris origin in the upper 1/3, it is the most it is deeper than the soleus muscle. Then in the middle 1/3, it lies on the soleus bed. So this is the Achilles tendon, soleus, and here we have the plantaris. These are the deep muscles: flexor digitorum longus, flexor hallucis longus, popliteus, which is a small muscle and it does not act on the ankle joint, and the tibialis posterior muscle. You can easily identify the flexor retinaculum from the medial malleolus up to the calcaneum, and here is the transverse intermuscular septa between the superficial and the deep group. These are the tendons that later on goes in and get inserted on the foot bones. And this retinacula also forms separate compartment for the artery and for the nerves as well. This is the Achilles tendons, plantaris. These are the tendons for the tibialis posterior, flexor digitorum longus, flexor hallucis longus. Here we have the calcaneal tendon. This is the artery and the nerve, the tibial nerve. They also passes on a separate compartment and lead to the flexor retinaculum. Lead to the flexor retinaculum. These are the structures that passes lead to the flexor retinaculum, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and the calcaneal tendon. So the main nerve supply for this compartment is the tibial nerve, and the arterial supply for this we can term the tibial nerve or the posterior tibial nerve, and the arterial supply is the posterior tibial artery. Now the nerve, just have a look at the bones of the foot. Proximal row, calcaneum. This is the big heel bone, also called the heel. This is the calcaneum, and here we have the talus. This is the talus, the proximal row. Then we have the distal row that is formed by the navicular, cuneiform artery number, medial cuneiform, intermediate cuneiform, and the lateral cuneiform. This is the cuboidal bone, cube-shaped structure. And then we have the metatarsals and the phalanges. Total 7 bones of the foot that are arranged in two rows, proximal and the distal row. Proximal row में we have the calcaneum and the talus, and distal row we have the cuboid, cuneiform and the navicular. This is the navicular, this is the cuboid single, but the cuneiform are further three number. These are the medial cuneiform, intermediate cuneiform and the lateral cuneiform. I'm repeating again: bones of foot, calcaneum, talus, navicular, cuboid, cuneiform, medial, intermediate, lateral. Okay. Now the tibial nerve that is responsible to supply this compartment, posterior compartment, having 7 muscles, total number of muscles 7 in number, and they are further divided into superficial and deep subcompartments. The tibial nerve, just have a look on this slide. It originates from the sciatic nerve. The sciatic nerve originates from the sacral plexus L4, L5, S1 and S2. These are the rami, and they from the lumbar vertebrae L4, fifth lumbar vertebrae, first sacral vertebrae, second, third, fourth, and they together form the sacral plexus. The sacral plexus are responsible to give the important pudendal nerve in the gluteal region. I told you in my previous lectures as well. It gives the superior and inferior gluteal nerve in the gluteal region, pudendal nerve for the perineum, the area that lodges the reproductive organs in both male and female. And later on, it also gives very important nerve of the lower limb, that is the sciatic nerve. It also gives, when you recall your lumbar sacral plexus, a nerve to the obturator internus, quadratus femoris, and here is the sciatic nerve. That sciatic nerve that originates, or it lies on the posterior pelvic wall, that originates from the sacral plexus. It also supplies muscles of the posterior compartment of the thigh. Then it goes down through the greater sciatic foramen, and it lies on the ischium, between the angle of the ischial tuberosity and the ischial spine. Then it supplies the muscles of the posterior compartment as well. That is the semimembranosus, semitendinosus. These are the important muscles supplied by the sciatic nerve. So here is the sciatic nerve that gives supply to the biceps femoris, ischial tuberosity, hamstring muscles, long head, semimembranosus, semitendinosus, and the adductor magnus in the thigh. Later on in the popliteal fossa, it divides into two terminal branches, and out of which one terminal branch is responsible to supply the posterior compartment of the leg, the foot, also the foot, all the muscles of the posterior compartment of the leg. And it also divides into the tibial nerve, which can, in some books it is written as posterior tibial nerve, or we can use the term simply tibial nerve. Plus another division is called common peroneal nerve, or we can use the term common fibular nerve. They both are same nerve. So confuse me on a common peroneal nerve or the common fibular nerve. This is another division of the sciatic nerve. And where this division occurs in the popliteal fossa. Where this popliteal fossa is present, it is present on the posterior surface of the knee joint. We will study in our upcoming lectures regarding the popliteal fossa. Just have for the course of the sciatic nerve, then how it divides in the popliteal fossa into two further terminal branches. In my previous lectures, I told you regarding the piriformis muscle. This is a landmark muscle just beneath the piriformis muscle. In the gluteal region, sciatic nerve gives no branches. Then it enters the thigh. This is the sciatic nerve. It passes through the greater sciatic foramen, two ligaments, sacrotuberous ligament, the sacrospinous ligament, that possible to convert the notch into the foraminals and different structures emerging from that greater sciatic notch. Then it enters into the initially it supplies the hamstring group. Then it enters into the popliteal fossa. Here is the popliteal fossa, and over there it divides into two branches. You can see in this slide, common peroneal and common fibular nerve. Clinical anatomy of that nerve is very important because it winds around the neck of the fibula. And here is a tibial nerve that is responsible to supply the posterior compartment muscle. That tibial nerve, along with the posterior tibial artery, passes in the popliteal fossa. This is a slide showing the continuation of the sciatic nerve. Starting से course बताया, I told you कि initially it originates from the lumbosacral plexus, then it passes through the greater sciatic foramen, then ischial spine, and then it enters into the popliteal fossa. These are the terminal branches. Here you can easily identify the tibial nerve, and this is the common peroneal fibular nerve. Tibial nerve can also be termed as posterior tibial nerve. Now it gives the muscular branches to all muscles of the posterior compartment, but it lies in the deep subcompartment. This is important to remember. It do not lie in the superficial subcompartment. It lies in the deep subcompartment. Here you can easily identify this is the popliteal fossa. Gastrocnemius, the two heads of the gastrocnemius muscle forms the inferior boundary. This is the medial and the lateral head. And here the sciatic nerve divides into two terminal branches in the popliteal fossa, which we will discuss in detail in the popliteal fossa as well. This is the tibial nerve, and here you can identify the common peroneal nerve. This tibial nerve then goes down and it supplies important muscles of the posterior compartment. This tibial nerve passes between the two heads of the gastrocnemius muscle, the medial and the lateral heads. In the beach में से here is the medial head of the gastrocnemius, and this is the lateral head between the medial and the lateral head of the gastrocnemius muscle. Now, this is a slide showing the further descent of the tibial nerve. This is the tibial nerve. At the ankle joint, this tibial nerve passes deep to the flexor retinaculum, and it passes between the tibial artery, runs parallel to the posterior tibial artery to the tibial nerve, and it passes between the tendon, long tendon of the flexor digitorum longus and the flexor hallucis longus. Here is the flexor hallucis longus for the great toe, for the flexion. All the joints flexion of the great toe occurs by the flexor hallucis longus, and here is the flexor digitorum longus. Later on, it divides into 4 tendons for the lateral 4 digits. This is the flexor digitorum longus, and these two vessels, the posterior tibial artery and the posterior tibial nerve, they passes between these two vessels at the ankle joint. Later on, just at the ankle joint or posterior to the medial malleolus, this important nerve, the tibial nerve, posterior tibial nerve, divides into 2 more branches, lateral plantar nerve and the medial plantar nerve. These are the branches, terminal division of the tibial nerve. So tibial nerve gives muscular branches, articular branches to the ankle joint. Ankle joint को भी supply करेगा, muscles को भी supply करती भी गई है ऊपर. Terminal branches, lateral and medial plantar nerve. It gives terminal branches just posterior to the. This is the medial malleolus. Just posterior to the medial malleolus. This is the medial malleolus, and it also gives. It also forms one important nerve that is called sural nerve. How this sural nerve is formed? This sural nerve is formed by communication of one branch from the tibial nerve and one branch from the common peroneal nerve. Plus, it gives medial calcaneal nerve. This is the medial calcaneal nerve which supplies the skin of the heel. This is the medial. These are the branches of the tibial nerve. Medial calcaneal nerve which supplies the skin of the heel. I will repeat again the branches of the tibial nerve. This is the flexor retinaculum showing how the tibial nerve passes deep to the flexor retinaculum, and it gives medial calcaneal nerve which supply. This is the cutaneous branch that supplies the skin of the heel. Medial and lateral plantar nerves. These are the medial and lateral plantar nerves. Just at the point where the ankle joint is present, or posterior inferior to the medial malleolus. So the tibial nerve origin from the sciatic nerve की origin you all know from the lumbosacral plexus. Then in the popliteal fossa it divides into two branches, tibial and common peroneal. At the ankle level of the ankle joint, it passes between the two tendons, flexor pectorum longus and the flexor hallucis longus. These are the branches of the tibial nerve. Muscular branches to the muscles of the posterior compartment, articular branches to the knee joint. Medial calcaneal branch is the cutaneous branch that supplies skin of the heel. Sural nerve. This is the sural nerve. And terminal branches are two in number. These are the medial plantar and lateral plantar. Now regarding the sural nerve is formed by the medial sural cutaneous nerve of the tibial nerve. Tibial nerve gives one branch, that is the medial sural cutaneous nerve. Plus, medial sural cutaneous nerve combines with the sural communicating branch of the common peroneal nerve, and they together form the sural nerve. That is the cutaneous supply for the skin of the lower leg and the foot. I am repeating again. The common listen carefully. The tibial nerve and the common peroneal nerve, they gave cutaneous branches to form the sural nerve. Now, what are the names of these branches? From the tibial nerve, one branch, that is the medial sural cutaneous nerve, plus one branch from the common peroneal, that is the sural communicating branch. They together will form the sural nerve. That sural nerve supplies the skin of the posterior 1/3 of the thigh, plus the skin of the lateral side of the leg and the lateral side of the foot. This is the cutaneous supply. For the cutaneous supply, muscular branches it gives, articular branches to the knee joint, and the articular branches ankle and knee joint. Then the medial calcaneal branches supplying the skin of the heel, plus the sural nerve, which is also cutaneous nerve that supplies the lateral side of the leg, lateral side of the foot, posterior 1/3 of the leg, sural nerve. Medial and lateral plantar branches. At the ankle joint, these are the terminal branches. Here we have the medial and lateral plantar branches. Medial plantar nerve, lateral plantar nerve. This is the medial plantar nerve, you can see, and here is the lateral plantar nerve. These are the branches of the which nerve? Tibial nerve. Again, at a glance, view this slide. It will help you a lot. Sciatic nerve, origin from the lumbosacral plexus. In the popliteal fossa, it divides into tibial, common fibular nerve, or we get term common peroneal nerve. Then tibial nerve gives muscular branches to leg, cutaneous branch, medial calcaneal branch, plus sural nerve for the skin over the heel, articular branch to the ankle joint. Terminal branches, medial and lateral plantar nerves. Now the posterior tibial artery. The course for the posterior tibial artery. The posterior tibial artery, popliteal artery. In the popliteal fossa, there is a popliteus, a small muscle that forms the floor of the popliteal fossa. That popliteal artery that is present in the popliteal fossa gives the anterior and the posterior tibial artery. And that anterior and the posterior tibial artery, it runs in the posterior compartment. That posterior tibial artery runs in the posterior compartment just close to its origin. It originates in the popliteal fossa as a continuation of the popliteal artery. It gives the longest branch. It gives the longest branch, that is the fibular artery. You can see in this slide here is the fibular artery. In that popliteal artery, agar upar se trace kare, is a continuation of the femoral artery. Femoral artery divides into two groups. We discussed the superficial and the deep group. Superficial, when we have the superficial circumflex helix, superficial external pudendal, superficial epigastric, and the deep superficial group it originates. And the deep group will have the profunda femoris, and the profunda femoris gives the further perforating branches, medial and the lateral circumflex femoral artery. So the popliteal artery is responsible to supply, it divides into the popliteal fossa, into the anterior tibial artery for the anterior compartment of the leg, and the posterior tibial artery for the posterior compartment of the leg. That posterior tibial artery is also located in the deep subcompartment. This is important to learn. The deep subcompartment contains the important vessels. Therefore, any injury to the any damage to the motor vehicle accident or either fall, any trauma to the leg, if it is deep and it involves the deep compartment, subcompartment, it can damage the artery and the nerve also. This can lead to the muscle paralysis. Agar deep hoga to, because the artery and the nerve, they are present in the deep subcompartment. Agar if there is minor trauma, then it will only involve the superficial group, superficial subcompartment. Compartmental syndrome can happen if it occurs, if it involves the deep subcompartment, because the main artery and the nerve of the compartment is located over there. This is the popliteus muscle, and it will form the floor of the popliteal fossa. This is the popliteal artery, upper se femoral artery, SCIATIC, and then here it runs parallel to the tibial nerve, the popliteal artery. That popliteal artery and the tibial nerve, they also, when they exit the popliteal fossa, they passes through the tendinous arch, of which muscle, the soleus muscle, that forms an inverted U-shaped tendinous arch. यहाँ नीचे की साइड पे soleus muscle होगा, so it passes यहाँ पे origin. Okay. Fibular artery. This is the common largest branch, not the common, largest branch of the posterior tibial artery at its origin in the this is the popliteal fossa. The popliteal artery divides into anterior and posterior tibial artery, and here the posterior tibial artery gives its longest and the largest branch, that is the fibular or the peroneal artery. You can see in this slide the posterior tibial artery. This artery is responsible to supply the muscles of the posterior compartment: gastrocnemius, soleus, plantaris, flexor hallucis longus, flexor deltorum longus, tibialis posterior, and the popliteus muscle. This is a slide showing the flexor retinaculum again with attachment superiorly to the medial malleolus. This is the medial malleolus, and inferiorly to the calcaneum. This flexor retinaculum, this showing how it holds the tendon in place properly, the function of the retinaculum, plus it also lodges the important nerve and vessel of that compartment, that is the posterior tibial artery and the posterior tibial nerve. This is the posterior tibial artery and the posterior tibial nerve. Tibial nerve passes between the tendon of the flexor deltorum longus, you can see, and the flexor hallucis longus. This is and the posterior. These two vessels passes between these two important muscles, tendons, flexor deltorum longus and the flexor hallucis longus, just above the ankle joint or above the flexor retinaculum. You can see in this slide. Now at the lower end, the posterior tibial artery, like the posterior tibial nerve, the tibial nerve also gives two branches, medial plantar nerve and lateral plantar nerve. It gives two branches. It divides into two terminal branches. These are the medial plantar artery and the lateral plantar artery. At the ankle joint, at the point of the ankle joint, medial plantar artery, and the lateral plantar artery. This is the medial plantar artery, and here is the lateral plantar artery. This is the posterior tibial artery. Here is the posterior tibial. You can see in this slide the posterior tibial artery. This is the posterior tibial artery. Now the branches of posterior tibial artery origin from the popliteal artery in the popliteal fossa, close to its origin. It gives one larger branch, that is the perineal artery. Okay, then popliteal artery divides into anterior tibial and the posterior tibial artery. Posterior tibial artery muscular branches to the muscles of the posterior compartment. Large branch, that is the perineal artery. One nutrient artery to also give to the bone tibia. Anastomotic branches, anastomos करेगा किसके साथ? Around the ankle, or we can say the articular branches to the ankle, popliteal artery will supply. And the terminal branches, just like the posterior tibial nerve and the posterior tibial nerve are same. Posterior tibial artery, it gives medial and lateral plantar arteries. This is the course for the posterior tibial artery. From the popliteal artery at the lower border of the popliteus muscle in the popliteal fossa, it divides into anterior and posterior. It supplies all muscles of the posterior compartment, and then terminal, it passes deep to the flexor retinaculum, and then it gives terminal branches. These are the medial and the lateral plantar arteries. Now the clinical correlation, you can feel pulsation of the posterior tibial artery just behind the medial malleolus, posterior inferior part, posterior surface of the medial malleolus and medial border of the calcaneal tendon. It can be palpated between the posterior surface of the medial malleolus and posterior border of the calcaneal tendon. Posterior inferior to the medial malleolus, you can easily feel the pulsation of the posterior tibial artery. You can easily feel the pulsation of the posterior tibial artery just at the posterior inferior part, posterior to the medial malleolus. So, the muscles of the posterior compartment, the artery of the posterior compartment is the posterior tibial artery, origin from the popliteal artery. The nerve of the posterior compartment is the tibial nerve that originates from the tibial nerve, that is it originates from the sciatic nerve, and the sciatic nerve originates from the lumbosacral plexus. So these are the components of the posterior compartment of the leg. Any question related to the topic posterior compartment of the leg? Okay, sural nerve. Sural nerve is formed by two important nerves: the tibial nerve, posterior tibial nerve, and the common peroneal nerve, or we can term synonym for the common peroneal nerve, common fibular nerve. One from jo branch from the tibial nerve it comes, that to form the sural nerve is the medial sural communicating branch, and one branch to form the sural nerve comes from the common peroneal nerve is the sural communicating branch. They together will form the sural nerve. Okay. Any more question related to the topic? Sural nerve. Got my point? Tibial nerve lies in the deep compartment and supplies muscle in the superficial group of the posterior compartment. Yes, muscles in the superficial subcompartment, muscles of the posterior compartment. Yes, it supplies all the muscles of the superficial subcompartment as well as the deep subcompartment. Gastrocnemius, soleus, plantaris, flexor, digital longus, hallucis longus. All the muscles are supplied by this tibial nerve. Okay, gastrocnemius and soleus, although they have common tendon, but they can perform their function at different time. They can perform their function separately, gastrocnemius and soleus, although they have common tendon. Yes, navicular is a bone. Navicular calcaneum, talus in the proximal lobe. Distal domain we have the cuboid, cuneiform, 3 number, medial, lateral, intermediate, and navicular. What are the terminal branches of the posterior tibial nerve? Now write down in your chat box. What are the terminal branches of posterior tibial nerve? And where it gives these terminal branches? Posterior tibial nerve. Yes, please write down posterior tibial nerve, the terminal branches of the posterior tibial nerve. Good. Medial and lateral plantar nerve. Very good. And the point where it gives these nerves, where it gives these terminal branches, foot at the ankle joint, close to the ankle joint. It passes deep to the flexor retinaculum. Okay. Near the ankle joint. Very good. These are the terminal branches, medial and lateral plantar nerves. The posterior compartment of leg, all muscles, they help in the plantar flexion of the ankle joint, except the popliteus muscle, because it does not cross the ankle joint. It helps in the flexion of the knee. Okay. Any more questions related to the topic? Source and no, femoral artery is very important artery. You have to learn the origin from where the femoral artery originate and what from where continuation is here, where it starts, where it ends. This is important to remember the source. Okay, plus the branches. Yes, this is also important. Popliteal fascia, investing fascia. What is investing fascia? Popliteus muscle. We will the investing fascia of the popliteus. Okay, the muscle is covered by a protective layer. When we will do our popliteal fossa, we will go through this plus one important bursa that lies deep to the popliteus muscle, that is the popliteal bursa as well. Okay. Okay, I'm leaving this meeting over there. I hope you are able to understand the attachment of the calcaneal tendon, how it gets attached to the calcaneal bone, and the attachment of the plantaris muscle, the flexor retinaculum, the important structures that passes deep to the flexor retinaculum, the neurovasculature between the features, the important points regarding the anterior posterior tibial artery, the posterior tibial nerve, the origin of the posterior tibial nerve, and how it divides in the popliteal fossa. For physical classes, no idea. 8 तक तो we have lockdown and don't know अभी circular वगैरह कुछ नहीं आया regarding the physical classes. Okay, so I'm leaving this lecture. I think there will be an assessment for the lower limb. Don't know if it will be physical, then we will go for Viva. Otherwise, there will be quiz. So be prepared for this in the next week, upcoming week. Upcoming week, there will be a quiz if we will not go on the physical. Okay, so be prepared for the lower limb. That's why I'm informing you. 7 week के first day में, okay? In the 8th week, at the 8th week, we will have a quiz, or if it will be physical, then we will go for YY. Okay? Allah Hafiz.
मैम क्लोज करना है।